Hi, I'm Shalini Bhardwaj. You all are watching ITV Networks Medically Speaking. So, in our last episode, we discussed about oral health, and today we are going to discuss about latest advancements as well as challenges related to urology. We have with us on our panel Dr. Anup Kumar, who is a HOD of Urology, Safdarjung Hospital, and Dr. Anand Kumar, who is the head of urology and renal transplant division at Max Hospital. And in later we are Dr. Rajiv Sood, who is a dean of PGIMER RML Hospital, who is a chairman of Indian School of Urology. He is going to join us. And Dr. Amlesh Seth, who is a HOD of Urology at AIMS, he is also going to join us. So let's go to Dr. Anand Kumar. Sir, my first question is related to, how many challenges are involved in especially kidney transplant if we talk about?
Yeah, kidney transplant actually it involves the two person. One person who is going to get the kidney and one who is going to donate. And then it is another very unique situation in medical field. This is the only operation in which one healthy person is undergoing operation to give one of organ or part of the organ to somebody else to live. So this is a very unique situation. Or somebody who has just died and has agreed to donate his organ, and those his organ can be given to others. So it is a big challenge. And nowadays we have a nuclear family. Suppose somebody has got the kidney disease, and previously there in a family there used to be at least 2 3 4 children. Now there are usually 2 children. If they are not matching or there is a problem, or one is has gone outside the country or other things, so there is a lot of problem people are facing to get the donor. And kidney transplantation apart from it also is a very financially and emotionally draining situation, because treatment is expensive, it goes throughout the life, and the initial preparation is also required. At that time patient undergoes dialysis, lot of tests to see whether he's fit or not to undergo transplant. Then his donor also needs lot of tests to find out what is his problem, how he can be taken care of. So all these issues are there, and then we go for the transplantation. So, and sometimes there is no member in the family who is fit to donate, even if they want to donate. But suppose only a healthy person can donate. Suppose the donor has got the some liver disease, or his both the kidneys are not good, or he has a diabetes, or he is a severe high blood pressure, or he is a heart disease. So even if he is willing to donate, he wants to save the life of his son, daughter, or sister, anybody, but he cannot donate because we cannot risk his life while taking out his kidney and donation. Because we are a doctor, our job is to make sure that person who is donating should remain healthy, he should not suffer, and those who is going to get a kidney should also do well. So these are the various challenges we face.
Sir, how much risk is involved in kidney transplant?
See, kidney transplant nowadays has become a very routine procedures. Like first, I'll take the kidney donation. Kidney donation is done laparoscopic. The procedure is takes usually 1.5 to 2 hours to do. Patient is admitted for 3 4 days. Next day, patient and he gets only very small incision to take the kidney out. Next day, the patient is walking around, moving around. Third, fourth day, patient is discharged. Within 2 3 weeks, he is fit. After that, he doesn't need any medication. He doesn't need any precaution, and he can do anything except two things. He cannot join army and the police. Apart from that, he can do the hiking, he can do cycling, he can marry, he can produce children. So donor has no risk, and the operation has become very safe. But 1 in 3,000 may get some complication,
Sir,
and the
and
recipient operation has also become very safe. Yeah, please go ahead.
sir, do you think still we need a awareness because people still feel that they should not donate a kidney, especially family members also. There is a hesitancy amongst them.
Yeah, you are very right. See, the problem is, I'll tell you, those who donate the kidney, we salute them. It is not an easy decision. If I ask somebody to give 100 rupees, he thinks few times before he gives 100 rupees. If I ask somebody to donate his blood, because donation of blood is no problem. You give the blood, nothing happens. Within few hours, your blood is replaced. So still people are hesitant to donate. And here you are asking somebody to undergo a major operation to donate your kidney. So it is not all that simple, but still people donate. So those who donate, they take lot of courage, lot of self-determination to help somebody. So they are doing a very good altruistic act to save somebody's life. So, and it's not easy decision. So it takes time. So we talk to them, we counsel them, we give them literature to read, we build their confidence. But a lot of people come forward. So I salute them. They have done a great job. They have saved somebody's life. So yes, it needs awareness that donation is simple, donation is safe, it is done laparoscopically, so there is a no disfigurement of the abdomen, and very soon you are back to your work, you can do anything. So it is very safe procedure and you can save somebody's life. And there another thing which needs lot of awareness, which is known as cadaveric donation or disease donation, donation after
Donation
the
after.
death. Yeah, this is very important. That needs awareness, because we have so many people are dying, especially with the roadside accident, brain hemorrhage, clot in the brain, anoxic damage, and sudden cardiac death. So these people, when they are in the hospital, if the family agrees to donate their organ, then one person can save many people's life. Like he can donate two eyes, one liver, two lungs, one heart, two kidneys. Then he can also donate his pancreas, small bowel, cartilage. So many things he can donate. So one person can save seven persons' life. And this is not a medical dream or fiction. It is reality, and it is happening. It is happening when the family allows it. So what awareness is required, that people should know that when somebody has died and his brain dead and his organs are still functioning, he is on ventilator, and doctors, when they tell that he can donate the organ, so if they give consent, then we can take out the organ and save many people's. And now system is there, law is there, there is a noto is there, many foundations are there, that noto, national organ transplant tissue and organ transplant department, they allocate the organs. So there is nothing to fear. There is a law, there is a system. They just have to give the consent, so that we can take out the organ and distribute it and save many people's lives. So this awareness is required, and I hope by this TV program people are listening and may understand and do it in future.
That's true, sir. Thank you for sharing, sir, so much important information. Dr. Anup, my next question to you, sir, it is that, sir, what are urology cancers, and do urology, especially a urologist, treat cancers? There is some, people are not aware about it.
Yeah, definitely. The urology cancers are being treated by the urologist, and we call them uro-oncologist. It's a separate subspecialty these days. That includes the cancers of kidney, bladder, prostate, and along with that, tumors of penis and testes. And then, of course, it also includes adrenal tumors. So these are all tumors which we include in renal, in the urology cancers. Now, all these cancers, they have varied presentations, they have varied stages, and there are a lot of advances which have taken place in the field of urology. Earlier, it used to be open surgeries for all the cancers. Then there come an era of laparoscopic surgeries, which was a minimally invasive surgery. But again, the laparoscopic surgeries had some disadvantages, some limitations, especially in some difficult, challenging cases. And there came the era of robotics, and therefore this robotic era has come for the last 20 years. For the last 20 years, various kind of cancers, whether it's prostate, advanced kidney cancer, bladder cancer, and even testicular cancers, which are having nodes in the retroperitoneal areas, and even the inguinal lymph node dissection. You name a surgery which is complex, and it can be done by the robotic. And that's what has come in the last 20 years, and the benefits we are seeing in terms of least morbidity to the patients. The mortality has decreased. Patient doesn't have a long incisions which we give in the open surgery, so there's less pain, less blood loss, lesser need for the blood transfusions, and patient recovers faster in the post-op period. The recovery is faster, and even the oncological outcomes, which I mean that when we remove the cancer totally and we are not leaving the cancer behind, that's known as oncological efficacy, that is also increased and enhanced, and it is equivalent to an open surgery. And then we talk about the functional outcomes and quality of life outcomes, which I think very important in today's era when the patients are very aware of these things and they demand a good quality of life. We can give them a very good quality of life. Let us talk about radical prostatectomy. Earlier, patients were having this fear of that they will leak the urine continuously after surgery, or they can also lose their erection after surgery, especially if they are sexually active before surgery. Nowadays, with the robotic approach, we can not only give them excellent continence, and many of the patients are immediately continent after surgery, and almost 80 to 90% will become continent in 3 months, which is a very good number. We can also preserve their erectile function. That means we can preserve the nerves which supply the penis responsible for erectile function, and therefore these patients can be sexually active within the next 6 months of surgery, which is again a boon for these patients. So many of our patients, they're living a normal life after surgery, and they are living a good oncologically efficacious life. So I think this is what we have the advances in the various
That means
cancers
we
I've
can
just
say
given.
that, sir, artificial intelligence is very useful in neurology, right?
Yeah, definitely. The artificial intelligence is a big field which is going to be there in the robotic field also. Right now, we are not using that artificial intelligence, but yes, we have the robot which are coming using the, because right now these robots don't have haptile feedback. That is no tactile sensation which we have in open or lap. But in the artificial intelligence, we are going to have this haptile feedback again, and that will improve the outcomes of the surgery, and we can have outcomes. So you're right, artificial intelligence is the future of all these technologies, especially robotics, and we are looking forward to this.
So we have Dr. Amlesh Seth also, who is the actuary of urology from AIMS. Sir, what are the latest developments in urology?
There are so many. It's very difficult to talk about one or two. Dr. Anoop has already talked about robotics, and you introduced the topic of artificial intelligence. Uh, uh, in urological cancers, gene therapy is coming up, and targeted therapy has already been there. And there are multimodality treatment for urological cancers is something which is becoming more and more streamlined. The cure rates for testicular cancer is as high as 99%, and a good longevity is provided in patients of cancer, prostate, kidney cancer, bladder cancer. In bladder cancer, although I should not call it a resurgence, but a new bladder formation has been going on for, I would say, about 2 or 3 decades, where if the urinary bladder is taken out, then a new bladder is formed from the intestines, and the patient voids almost as if the patient has the native bladder. Uh,
Because
what else? I
people
mean,
feel like, if the bladder will be removed, right, they are in this fear. This is a literally a very, a latest development, we can say.
yes, those who have a cancer which is not too advanced, and the ones who the cancer is advanced enough to need removal of the urinary bladder, but not too advanced that a new bladder cannot be formed, because the patient's continence must be maintained. If the continence is gone, then there's no point making a new bladder. So if the area where the continence is present, if that area can be saved, then a new bladder can be made.
Okay. Dr. Rajiv Sood, we have Dr. Rajiv Sood also, who is a Dean of PGIMER RML Hospital and Chairman of Indian School of Urology. Sir, my next question to you is, sir, that how COVID-19 has affected urology?
See, in urology, we have all kind of exposures to the health workers, which are to any other discipline also. But the special thing is that in urology, we are having a lot of diseases which are very common, and right from UTI to cancers you were talking, or the kidney stones, ureteric stones, or stone disease, prostate disease for elderly, where the comorbidities are also there. So we have the elderly patients, especially. So the patient profile exposes them to COVID pandemic, and also they are more predisposed because of the comorbidities occurring side by side. Now, in urology, heavy OPD rush is managed by different protocols of social distancing. The screen is, face screen is also used. The screen between patient and doctor is also used, and hand hygiene and keeping distance, all are important. Now, recently, two more concepts have been added. One is the telecounseling. Telecounseling, which we are taking use, because the last March onward, it has been legalized. And if you see a patient and you are examined, you have already examined for next 6 months, you can do the telecounseling through any social platform or any dedicated platform. So that is one. The second thing is that we have modified certain guidelines in urology. Maybe they are the normal treatment, indoor treatment, OT protocols are there, all OPD indoor and OT protocols are there, and also cancer guidelines are also modified. I'll give you a small example, like prostate cancer. If everybody has to treat once we recognize it is a cancer, unless it is very slow growing or it is very safe, low risk disease. But when there is a chance, we have to decide whether we are going for biopsy or not. We have to decide the imaging or not, the therapy protocols. We have modified the radiotherapy, that is the radiation protocols also. Operations also, initially there was a lot of apprehension for the laparoscopic surgeries, because aerosol spread and all were also feared. Now, because of certain precautions and special protocols, we are able to perform those also. Urological surgeries sometimes are very small. They last for just cystoscopy and very short duration, and sometimes they are very time consuming. They may last for 7, 8, 9 hours also. So we know that in COVID, for the long procedure, the exposure is long and the viral dose is also high. So if we have to decide whether we are going for short procedures, long procedures, short exposure, long exposure, how many time we are calling the patient. If we are giving chemotherapy, and as Dr. Amlesh was telling, that there are target therapy also, or the pills are also for some alternate treatment, maybe the second line hormone treatments for that cancer, for example, prostate, there are pills also. So we were preferring that we don't hospitalize the patient, give the more and more the outdoor treatment or home care whenever it is possible. Now coming to the effect of COVID on the pre-existing renal conditions or the urological condition and condition caused by COVID. So that is also very important area, because we have identified lot many biomarkers. Biomarkers are that if they are present in the organ, we know that these organs are exposed to more damage. Now there are ACE2 receptor. ACE is the angiotensin converting enzyme. So that is very important, and that is in different organs that is present, right from the entry point of nose and oropharynx or eyes. It is there in the intestine also there, but in the urological tissue like kidneys, especially in the proximal tubules, they are present. The ACE inhibitor, and this is the entry point for COVID virus. And once they enter through this, they start replicating. And therefore, for urologists, one thing become important, that in no previous comorbidity also, patient is exposed to acute kidney injury. And sometimes these acute kidney injuries are very serious. If the pulmonary means lungs are affected, they go high, their morbidity, mortality also go high. So maximum acute kidney injuries are occurring in ICUs, in indoor, compared to the outdoor or home care COVID patients. And this may have long-term consequences. Then for the urologist, there are certain procedures like kidney stone and all. We are not able to accommodate them. Lot many OTs were shut, and there is a lot of backlog. Patients are suffering. We have to take care. So this is the another thing in urology. The third thing I have already touched a bit about the cancer, about the radiation, like you give the doses, you go for hypofractionation, means small doses you give. And also then surgeries, we have to decide whether we can postpone the surgeries. And also there is a effect on fertility, lot of effect. And there is a effect on the population. The population also, fertility first I'll tell, because of the inflammatory reactions, the Leydig cells, which are important in the spermatogenesis and all, because of the direct infiltration of the inflammation. Inflammation is the main problem in COVID infection. And testes get damaged, fertility get affected, and it has been found that the fertility rates go down. Not only that, there is another angle, another end of the spectrum. That is that because of the undesired conceptions, you are not able to go for MTP, the medical termination of pregnancy. And there are, because of the proximity and different work from home and social conditions, there are in some countries, like advanced countries, educated countries and all, there had been decrease in the population because of the involvement of the mental health also. But
it has affected population also.
yeah, it is connected with the population also. In India, it was found that 3.1% increase in the birth rate, and that is called the baby boom. I'm telling you, in many countries, the population is going down, many it is going up. Directly sexual organs and sorry, genital organs are affected.
Dr. Anup, sir, my next question to you. Sir, why so much infertility is increasing in men, especially in younger generation, we can see?
The causes for infertility which are increasing, we can enumerate. One is the increased use of alcohol and tobacco in our younger generation. They are using it more often. Then also we are seeing the increasing in the trend of diabetes, which is the type 1 diabetes, which is increasing in our younger population, and even hypertension. And this is all because of these are lifestyle diseases. These days, our younger generation, they do not take healthy food, they do not exercise, and they are having obesity. So just like in USA, there's a pandemic going of obesity. In India also, we can see numbers of patients who are obese are increasing. And of course, other than that, we again have some other idiopathic genetic factors also, which are increasing the infertility cases in our India. And therefore, it is very important, number one, to have a healthy lifestyle. Do not take alcohol or do not take any tobacco. You should have at least 30 minutes of exercise per day. Do not take any do not take any frozen meat, because the meat contains very toxic chemicals which can impair your sperm productions. And then, of course, avoid extreme heat exposures, because extreme heat exposures also can lead to the failure of the spermatogenesis. Then, of course, certain chemotherapeutic drugs can directly affect your sperm productions, and they are always warned about the sperm, basically the production decrease after the drugs. And these patients, we can actually preserve their sperms before starting chemotherapy, so that these guys can have the child with the in vitro fertilizations.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.